Welcome back. In today's video, we are going to discuss about cerumen. Cerumen or earwax. Cerumen or earwax, which is secreted from our ears, comprises of the secretions of sebaceous glands, the sebaceous glands which are rich in fatty acids, then the ceruminous glands which are also the modified sweat glands. They are rich in lipids and pigments. Hair, desquamated epithelial cells, the debris and the keratin and dirt. These secretions of sebaceous glands, ceruminous glands, hair, desquamated epithelial debris, keratin and dirt is nothing but cerumen. Usually small amount of the earwax will be formed and it can be dried up and expelled from the meatus by the movements of the jaw. The movements of our jaw will automatically expel the earwax from the auditory meatus, external auditory meatus. But in cases where the excessive wax is being secreted by the glands, it will be deposited as a plug in the outer external auditory canal. You can see here in the picture the excess wax being deposited like a plug in the external auditory canal. What are the functions of cerumen? Cerumen is protective in nature. It is lubricating the ear canal and it also entraps the foreign materials. It has acidic pH and it is bacteriostatic and fungistatic. So, it is going to entrap the bacteria. It is making the bacteria static, entrapping the bacteria, fungistatic, bacteriostatic, and the foreign materials are entrapped by the earwax. So, it is protective for the ear. And also it is acting as a lubricant. These are the functions of the cerumen. Now we move on to the clinical features. The person who is having the excess cerumen deposited like a plug in the ear canal, what happens in them? They will present with the decreased hearing. It's like an obstruction in the ear passage. So the hearing is obviously going to be decreased. There is a sudden hearing loss. The wax is going to swell up due to the water entry. Now it has been deposited there. Now the water is entering while showering or whatever. So what happens? The wax is going to swell up and as a result the hearing loss will be there. Sense of ear blockage. Tinnitus and giddiness. Tinnitus is the ringing sound in ears and also the person will have giddiness, vertigo. Cough reflex. So here the cough reflex is also going to be initiated in them. It is because of the nerve innervation in the external auditory canal. It is also originating as a division of vagus nerve. It is known as Arnold's nerve. So the cough reflex is elicited because of the nerve innervation of the external canal, which is the division of the vagus nerve. It is also known as Arnold's nerve. Okay. And also the long-standing cerumen will form a wax granuloma. You see the long-standing impacted wax. What will it do? It will result in the ulceration of the meatus. Then once the ulceration is there, later on the granular formation occurs. This is how the clinical features the patient presents with. Okay. Decreased hearing, hearing loss, ear blockage will be there, tinnitus, giddiness. Now we know why the cough reflex is here. And the long-standing cerumen will form the ulceration. Once there is ulceration, there will be granuloma formation. The treatment, if a person has a wax deposited, if he is having these clinical symptoms, how do you treat the cerumen or earwax? It consists of the removal of the wax by either syringing or other ear instruments are present. Wax softening agents. So first, to remove the wax which is hardened, which is deposited there like a plug, what we have to do? First we need to soften the wax for the easy removal, to not harm or cause more pain to the patient. So what we do? First we do the softening. The hard impacted mass usually needs a prior softening with any one of the following wax softening agents: 5% of soda bicarb in equal parts of the glycerin and water. So you're taking equal part of glycerin and equal part of water and mixing 5% of soda bicarb, sodium bicarbonate, and then it is used as an agent to soften the wax. The other agents will include the hydrogen peroxide. Any kind of wound to heal, like while dressing, you use hydrogen peroxide. So here, to clear the wax, to make it soften for the easy removal, what we do, add hydrogen peroxide. Liquid paraffin, olive oil, and paradichlorobenzene 2%. These are the softening agents. Now once we have softened the wax, now we'll move on to the removal of the wax. Instrumental manipulation should always be done by the skilled hands, preferably under ear microscopy. Not like in the home, anyone can attempt and remove the wax. It's not like that. Once it's a hard mass deposited and then there is granuloma formation and everything, hydrogen peroxide and the other softening agent should be added, and only the skilled person has to perform this. Cerumen hook, you can see in the picture, the Jobson horn probe. Here I have given in the picture the Johnson probe, horn probe, how it's going to be. The cerumen hook, the scoop, like how the ice cream scoop you can imagine. Just like that, we are going to put a scoop and remove the wax. Jobson horn probe are usually employed. Wax hook and vectis are used for removing the wax, the foreign bodies, the debris from the external ear canal. It may be used for removing the foreign body from the nose as well. So these instruments like the wax hook and the vectis are also used for removing the foreign bodies in the nose. Just like in ear, the foreign body, the wax is removed, same way in the nose as well. In cases of the impacted wax, a space is created between the wax and the canal wall. You can see very beautifully given here. Between the ear canal wall and the wax, they are creating a space priorly, so that this instrument can pass through and you can plug it in here and remove it. For this process, what you're doing, creating a space between the wax and the canal wall. Then the instrument is passed beyond the wax and the lump of the wax is then dragged out. If the lump is breaking, in case while removing, if the lump is going to break away, you have to do the syringing or the suctioning so that it can suction out the lump and remove the fragments. With this, I guess we come to an end of the lecture. Hope everything is clear. If you like my video, hit the like button and subscribe.